And it really goes to prove that if you don't measure something, nothing will be done about it.
And we have to make New Jersey's business climate more attractive for entrepreneurs.
We are Wonder Women. Like, look at all these women and what they've done and what they've tried. And even if they didn't succeed, they gave it a shot.
I don't think it's fair to put a $4 or $5 billion price tag on middle-class New Jerseyans.
We've got a great lifestyle here, and I don't want to see it ruined because politicians can't manage our finances properly.
Welcome to As a Matter of Fact. I'm Lisa Allen, and today we are filming from Hometown TV Studios in Summit, New Jersey. Today we're talking about Medicaid. In 2013, Governor Christie was one of the few Republican governors that accepted the Medicaid expansion offered by President Obama's Affordable Health Care Act. Late last year, Governor Christie announced that over 500,000 people successfully signed up for Medicaid in New Jersey since the expansion. However, this year, the future of affordable health care hangs in the balance as the health care debate rages on in D.C. And this debate has sparked new conversations around Medicaid funding and the life of the program. To help us understand Medicaid and the many complexities, we welcome Erica Malik. Erica has spent her entire 16-year career dedicated to healthcare policy and offering real solutions to improving access to healthcare for some of the most vulnerable citizens. She has worked with research professional organizations, including Mental Health America, and has served as a consultant providing insight and research to support efforts to transform the American healthcare system. Welcome, Erica. It's so good to have you today.
Thank you so much. It's a pleasure to be here.
I'm delighted. You and I have been talking about healthcare and Medicaid for months. So I have been anxiously awaiting this day.
Yes.
But before we get started, I really want the viewers to know a little bit about you and your background and understanding how you relate to Medicaid.
Yes, thank you. And thank you so much, Lisa, for having me on. It's been so exciting to be talking to you about these issues over the past few months, and I'm excited to be able to explain the issues around Medicaid a little bit more clearly to people who watch this show. Yeah. My background is that, as you said, I have been working in healthcare policy for the past 16 years. I work with right now I'm working with a small consulting firm called Momentum Health Strategies. Mm-hmm. And what we do is we provide real solutions for organizations and advocacy groups and healthcare groups that are trying to improve healthcare across the country. For example, for the past few months, I've been working on a series of fact sheets on Medicaid to explain how Medicaid and what it does for people specifically with mental health disorders, and how people are able to access those the Medicaid program for every state. So we've gone through and we've done some research for every state on Medicaid and specifically for people with mental health disorders in the past 6 months.
That's incredible.
Yes.
Well, you know, on that note, I've started doing a lot of research. I didn't really understand Medicaid. Mm-hmm. I don't understand Medicare, how it all fits together as the pieces of the puzzle.
Right.
But I feel like I've learned a lot. So I think we should start from the very basics to help people kind of set a foundation. So the question is, why are we talking about Medicaid today?
Right. So as you know, for the past few months, there's been this huge debate about repealing and replacing the Affordable Health Care Act. And a lot of the Affordable Health Care Act primarily deals with people with individual health insurance. So that's not the insurance that you get through your employer, but it's insurance that you get as an individual that's just purchasing your own health care insurance. Mm-hmm. But it also deals with Medicaid. And I think that part of the reason that the repeal and replace did not pass in the past 6 months is that people have discovered that Medicaid is actually a very important healthcare program. And that many of the politicians were very surprised when the federal government was suggesting to significantly change the way that Medicaid is funded and provided, and that the people in the states, including the Republican governors who did the Medicaid expansion, like New Jersey, said, no. We need to keep this program because it's far better and much more effective than people give it credit for, mm-hmm. and much more important.
Right, and not to get ahead of myself, but Governor Christie did say that they saved money from the Medicaid expansion, even though there was money spent because you're bringing in more people. Overall, it cut expenses back in New Jersey.
Yes, exactly. And what they found was that in particular, the level of rate of uninsurance in New Jersey has gone down by 35% since 2013 when we did the Medicaid expansion. And also what we have found is that the amount of uncompensated care, which is when somebody goes into an emergency room, the hospital has to provide that care whether or not somebody can pay. And so then the hospitals basically eat the costs and pass them on to other people who have regular insurance. And so those rates have gone down nationwide.
Wow. Okay, so let's break down Medicaid versus Medicare.
Yes.
So what is the difference?
So a lot of people hear Medicaid, Medicare, and they think, oh, they're just the same thing.
Right. I did initially.
Right. Yeah. But they are actually what I would think of it as two concentric circles. So they've got Medicare, and Medicare is they were both started in 1965, and they are both funded by tax dollars. However, there are significant differences. The Medicare program was started just to provide health care insurance for people who are over 65 and older. It is a national program, so it's run by the federal government, and it is the same program for everybody across the country. So you get the same services, the same reimbursement, the same costs across the country for Medicare. And that doesn't matter whether you're a billionaire or if you have very little money, you still have the same cost for Medicare. Medicaid is a program that was designed primarily for people who are very poor and people who do not have a lot of money. Now, there are a few people who have Medicare and Medicaid, but most people they're two different populations. The Medicaid program is a federal-state partnership, which means that the federal government pays at least 50% of the costs, and the state pays the rest and actually runs the program.
Okay, so what I'm hearing is Medicare is fully funded by the federal government.
Yes.
And Medicaid is a partnership between federal and state.
Right.
Right, and it varies from state to state.
Yes. People say in the wonky world that if you've seen one Medicaid program, you have only seen one Medicaid program because they vary so dramatically from one state to another. It also means that states are reimbursed at a different level, and so each year the federal government calculates the per capita income across the state and then chooses the reimbursement rate accordingly. So the lowest reimbursement rate you could get would be 50%, which means that, and that's what New Jersey has. So that means that for every dollar that New Jersey puts into the Medicaid program, the federal government pays 50% of it. So it's still a very good deal. There are states that are very poor, like Alabama and Mississippi, that are getting 70% of their Medicaid dollars are being paid for by the federal government.
So, and you say per capita, is that related to wealth? That's why we have 50%?
Yes.
Okay. And it also, I read somewhere where New York raised on their own, they decided that they would allow the expansion to cover 400% over their poverty line. Does that make sense? And then I think North Carolina was like 200%. So can you talk a little bit about that and how that works for New Jersey?
Okay, so when the Affordable Health Care Act passed, one of the major tenets that they did around Medicaid is that they provided an incentive to states to expand their Medicaid population. Let me take one step back, if that's okay, Lisa.
Yeah.
So there's four main groups of people who are in Medicaid, right? There are children and pregnant women. There are elderly that are very poor. There are people with disabilities who are, again, extremely poor. And then there's the Medicaid expansion population, which are able-bodied adults, but who have very low incomes. The Affordable Health Care Act said the federal government will help with payment for the Medicaid expansion up to 138% of the federal poverty level. I know these are a lot of numbers, so I will go through and talk a little bit more about them. So, and for those expansions, the federal government with the ACA said that they would fully pay for those Medicaid expansion populations, and then it would go down to, I think, 90% in a couple more in 2020. Now, what they also said, though, is that if the state is willing to pay, you can expand it as high as you wish, but the match rate from the federal government does not come when it's above those numbers. So for those states that have been able to expand it even past that 138% of the federal poverty level, like New York, that they don't get that matching rate from the federal government.
Oh, so New York decided to invest.
Yes.
Okay. And when you say poor, can you define poor?
Yes. Now, I think that that's something that is really hard to imagine for people who have full-time jobs with healthcare insurance and are not living paycheck to paycheck. The federal government defines the federal poverty level as somebody who, if you're one person of earning $12,060 per year.
Say that again.
$12,060 per year.
Wow.
There are people in Summit who earn that in much less time.
Yeah. Right.
So, and just to give you perspective, so part of the research that we've done this year, if you want to think about like what is the cost of living for like a no-frills budget, like not a huge amount of money, the national average cost of living for a no-frills budget for an individual would be about $28,000 a year. Mm-hmm. That's calculating that you need $9 a day per food.
Right.
If you look at Newark, which is because there is Newark, New Jersey is kind of like a close big city around here, an individual needs $34,000 a year. If you're talking about a family of four, you're talking about needing about $66,000 a year because housing is so expensive in New Jersey, and so that's why it's so much higher. Again, when you're talking about a family of four and a $66,000 budget, that means that you're calculating $24 a day per day for food for a family of four.
That is incredible.
It's so small. Mm-hmm. And you think about even if somebody earns above the, a little bit above the federal poverty level, so the most an individual can earn in New Jersey is $16,000, about $16,000 per year. That's still so little money to be able to afford basic things.
Absolutely. Well, I have an example. My hairdresser,
yes,
and I were talking, and she works a full-time job, but still qualified for Medicaid. So her and her kids were on Medicaid.
Right.
Then she ended up making a little bit more. The state allowed her kids to stay on Medicaid, but she got kicked off.
Yes.
So it's tricky.
It's very tricky. The states, generally what people have decided across the country is that some of the most important people to make sure they have access to health care are children, which I believe is a really important thing to note. So the income limits are much higher for children to be able to access Medicaid. And so that's why your hairdresser is not able to access Medicaid, but why her children are. And I think that it's an important thing to realize because what you're talking about is that if people get access to health care, their long-term health trajectory is generally much higher. And you're much less likely to use the wrong types of healthcare services in order to get access to healthcare. And so that's why it's really important to be able to get children, especially, access to care.
Absolutely. Well, and then I have another example where a woman was telling me that she works 3 part-time jobs.
Yes.
And so she's working,
yes,
but because she's part-time, she doesn't have enough, she doesn't make enough income, and she doesn't have access to health care, in which in her full-time job she did. So she said to me, I never realized there are certain services I don't even get under Medicaid.
Right.
So she's working a lot of hours, but it's all part-time. Can you talk a little bit about services that you can get under Medicaid or don't get?
Yeah, so the first thing to your point is just to, because there's been this idea that people on Medicaid are sitting around and doing nothing, but 80% of people in New Jersey who are on Medicaid are working. Some of them have, like what you said, multiple part-time jobs. 65% of those people have full-time jobs. They're working full-time hours and they still do not earn enough money to qualify for Medicaid. In terms of the benefits, Medicaid provides a wide range of benefits. It provides, and it varies per state, and so I don't want to go into too many details because, like you said, it gets too tricky.
Yeah.
But they do cover inpatient care. They do cover outpatient services in terms of going to get your preventative services, or if you get the flu, or if you get something like that. It will cover prescription drugs. What becomes trickier are these more specialty care, like mammograms, or sometimes dental care is not fully covered. So those are the areas where Medicaid is catch as catch can, and it varies widely in terms of what group that you're in terms of Medicaid, and also what state
What if someone said, let's just make it uniform? So like Medicare is uniform, and I know that right now we don't do that because it's on per capita and it's on wealth, but what if they just said, in order to fix this, we could make it uniform? Is it possible, or is that really more complicated?
Well,
easy question, right?
I think that to reach the right now, I don't even know how to start this one. I think we talked about this yesterday, and I said, well, let's talk about Alexander Hamilton and Thomas Jefferson's disagreements. The country, when we established our country, we really established it with each state having its own personality and its own structure of government. And part of the deal that they made when they developed the Medicaid program was that they were going to let each state implement the Medicaid program as they would fit their state's personality or their thing. I think that in theory, it would be more cost effective and potentially be able to reach a broader group of people if we were able to do a nationalized version of Medicaid. However, given our insurance structure as well as the political climate, I don't think it would be a potentially viable option at this point. I think that it would be certainly also because there's such variation even in terms of cost of living. As we said, the average cost of living in one state is very different from another state. It would also make it very hard in terms of reimbursement rates.
Right. I find it challenging though, because if you look at New Jersey, roughly 3 out of 5 births are born under Medicaid.
Yes.
Of the 24, I think it takes up Medicaid, you correct me if I'm wrong, because you know the numbers better than me, but I think Medicaid takes up 24% of the New Jersey budget, if I'm right?
So it actually takes up 12% of the budget. Okay. It's 24% of the budget if you include the federal investment.
Got it. Okay. And of that, 42% of the births are covered under Medicaid. Does that make sense?
Yes. So if you look at the distribution of who is on in the Medicaid program in New Jersey, about 41% of Medicaid recipients are children. And about 37% are able-bodied adults in the Medicaid program. And then the remaining are either the people who are older or the people with disabilities. However, the cost drivers are not the children. The children are actually generally pretty inexpensive to cover. It is usually the people with long-term care needs and disabilities and people who are older and sicker that are the ones who are much more expensive.
Right.
And I think that one of the things that we talk about is the cost of Medicaid. And as well as providing health care. And I think that there's a couple things to think about in terms of thinking about the costs of Medicaid. The first thing is that while Medicaid is 12% of the budget, and goodness knows if something happens to our economy or there's a healthcare crisis or the opioid epidemic hits our state much harder than it has in the past, and so we have a huge enrollment in Medicaid, that will hurt our state budget. However, if you then cut the Medicaid dollars because of the way it's set up, then you also lose the federal dollars.
Got it.
So if I'm spending $100 on Medicaid and then I'm getting another $100 from the federal government, if I cut that back to $50, then I'm still only have $100.
Right.
And that was designed intentionally because the Medicaid program is set up as part of our healthcare safety net, so that when the need grows, that our government is set up in order to help the people who need it the most.
Right. Let's talk about the disabled and the elderly, because we haven't really talked about them yet.
Yes.
Just explain that population a little bit more.
Yes. So the people who are on Medicaid, who are qualified as disabled, are people who are have very high and significant healthcare needs. Generally, that means that they are qualified for Medicaid through the Social Security Disability Income Program, which means that they are unable to work. That means they either have a developmental disability, they have a physical disability that prevents them to be able to be employed, or they have a mental health disorder like schizophrenia or bipolar that they literally could not hold a full-time job because they are so severely impaired. And those individuals, you know, it's a really tricky because those individuals have a lot of healthcare needs.
Right.
And so they have a lot of, they can be very expensive. I have spent a lot of my career working, advocating for the access to care for people with mental health disorders and mental illness. And the trick is that they may have a lot of healthcare needs, but if they don't get access to healthcare, they're much more expensive. Because when somebody who has a serious mental illness does not have access to health care, they're going to end up in the emergency room, which is not a good place for a person with a mental illness. They're more likely to be picked up by the police. And then people with, you know, the police are not well equipped to take care of people with mental health disorders. They may end up homeless. There's so many other things where you pay for that care. It's just what's the best way to pay for it.
Right. How are you going to pay for it?
Exactly.
On the front end or the back end?
Right, and it's
Right.
much more expensive. One of the things that people talk about when you talk about broadly about healthcare issues is that the United States is notorious because we spend a lot of money on healthcare, and yet our healthcare outcomes as a country are much worse than those with other developed countries. And part of that is because we do not have an ethos of prevention and of putting the care in the right place. And so I think that there are efforts going on within the Medicaid program and also in the broader healthcare sector to look at how can we invest in healthcare for, especially for these people who have chronic healthcare issues, so that we're spending the money in the right way and at the right time, and so that we're not having to spend so much money in the back end.
Right. And the elderly. So
Yes.
the costs are for nursing homes.
Yes.
I have a bout of experience with that because
Yeah.
my stepdad is in Wyoming. So
Right.
the law is different than it is in New Jersey.
Yes.
And with the the flux of where Medicaid is going, we may or may not be able to keep him in that nursing home. So
Right.
without getting really specific, maybe you can talk about, though, the impact to that for families. It's costly.
So I think that it's really important for people to realize, and I think that it's important, I appreciate that you're willing to share that story, because people often will say, oh, well, I would never need Medicaid. It's not something I would ever need. But the truth is that as we have family members that we love very much who have growing healthcare needs, especially at the end of life, and you can so quickly and so easily use all of your savings, and a Social Security check would never even cover a tenth of the needs for those costs. And so people can end up losing so much money and perhaps you have a family where everybody's working already, there's not a person who can stay home and care for that person. And that if we are cutting back on Medicaid for those most vulnerable populations, we're not just harming the individual, but we're harming the broader family and the broader community.
Because when we talk about financial, we're not talking about the impact of the money that is spent in time in taking care of those families.
No.
Because, I mean, even just as my personal experience, a father with dementia, I wouldn't even begin to take care of him, but when some things had changed, my brother and I were talking about potentially having to bring him into one of our homes, and I said, I can't even imagine, I'm not equipped to do that. So it's challenging.
And it's certainly something where if you have two people, a married couple, and you have one of them who develops Alzheimer's or dementia, and both of them are older, and so there comes a point where perhaps the spouse can no longer take care of their husband or their wife, and that makes it very difficult.
Yeah. The $1 million question. Is there a way that we can have these programs? Because it's not just healthcare, Medicaid, Medicare. It's Social Security, it's pensions,
Right.
it's education. I mean, these are really big issues and
Right.
challenges of our time. The $1 million question is, can we have these programs and have that delicate balance of taking care of who needs to be taken care of without exploding the debt?
It's a huge question, and I don't think there's one easy answer to that question. But it's so important. I think that people really have been living in the either-or mentality. And I think that there's also been a certain nostalgia to think that there's always going to be somebody in the home who can care for the person who may be have healthcare vulnerabilities, like either be older or have a mental illness. And that's just not how our world is functioning anymore. I think that I know there are a lot of research going on in trying to improve how we can deal with chronic care more effectively so that we can have better outcomes, but also be using our healthcare dollars more effectively. But it's not an easy answer, and there's not going to be one silver bullet. And anybody who tells you that there's going to be some simple answer to these really hard questions is fooling themselves. Because these, as you said, if you are dealing with your own person in your family, your stepfather or my grandmother who is going through these issues, you can't just solve it in a day. And even if you get them have access to Medicaid and you get them to have access to services, even with that, you still have a role in providing some health care services for them, caretaking, managing their budgets.
Absolutely.
So it's a complex issue.
It is, and it has more than doubled. When you look at when the program started, we've more than doubled the cost. So I'm just curious, are there organizations, you mentioned this, what kind of work is being done? Can you talk about that? Because I want to know there's hope out there. I do not want to leave my viewers with the idea that there's no hope here.
Well, so there's a couple things.
Dire.
So healthcare costs have gone up a lot in the past, 50 years. They keep on going up. In the last 10 years, Medicaid costs actually grow more slowly than private healthcare insurance costs. Part of that is because reimbursement rates for providers are a lot lower. That's a whole other issue. We can talk about that on our next discussion.
Yes.
But administratively, Medicaid is run fairly efficiently for a healthcare program. Part of the reason why healthcare costs have gone up is, one, we're living longer, and so people died younger, and so they didn't have as many costs for as long. Part of it is that we are able to do so much more, and so those costs also cost. So for a long time, they'd be like, okay, well, here's an aspirin and good luck with that. And now we have medications and treatments that they never had even 10 years ago. At the same time, there are activities that are going on around the country to conduct pilot studies and conduct research to be able to constrain both the cost of care as well as improve the quality of care. One of the programs that I have worked on is a program, and I need to be fairly vague about it, but it is a program that's aiming to reduce rehospitalization rates for people with serious mental illness. People with serious mental illness have a harder time following up once they've been in the hospital and maintaining their access to their health care. People with serious mental illness often have not just mental health needs, but also physical health needs. And so one of these programs is developed to try and make sure that those people, as they leave the hospital, that they are able to get access to care. And as I said, by focusing on getting people to the right place for their care, we can start using our healthcare dollars much more effectively and much more smartly.
Right. Well, I'm going to have you come back for mental illness.
Yes.
And talk about that. Because
that would be great.
It's already been 30 minutes.
I can't even believe it.
I know. I have more to say. Thank you so much for coming on today.
My pleasure. It's been great.
Great. Thank you. And thank you for watching today. To learn more about Medicaid, please visit the websites listed on our screen. As always, thank you for tuning in. We always appreciate our viewers. For more programming like this at Hometown TV, please visit hometowntv.org, subscribe to YouTube channel or at Hometown Television, and don't forget to like us and subscribe to our Facebook and Instagram at Hometown TV. See you on the next episode of As a Matter of Fact.